How does implant projection affect breast augmentation results? Imagine how a tiny change in how for an implant sticks out can completely transform the look of your breasts. That's what implant projection is all about. It's the measurement from the back of the implant, near the chest wall, to its most forward point. Implants with higher projection stick out more, giving a fuller, more prominent breast shape, especially in the upper part. Lower projection implants sit closer to the chest wall, creating a softer, more natural look. This difference is important because it influences the overall contour, fullness, and even how the breasts look in clothing. When choosing an implant, projection plays a big role in shaping the final result. Higher projection implants can give you a dramatic, rounded look with lots of cleavage, which many women find appealing if they want a noticeable change. They work well for women with narrower chests because they can add volume without making the breasts look too wide or out of proportion. On the other hand, lower projection implants tend to produce a more natural, gentle slope, especially if you prefer a subtle enhancement or want to mimic the natural shape of the breast. Your body type matters a lot when selecting projection. Women with narrow chests often benefit from high projection implants because they add volume without increasing width. Women with wider chests might choose implants with a larger base diameter and lower projection to keep the look balanced and natural. Skin and tissue quality also influence how projection appears after surgery. If your skin is loose or stretched, the implant might settle differently over time, sometimes reducing the initial projection. It's also important to remember that some loss of projection can happen naturally over months as the tissue settles and skin elasticity changes. Studies show that about 20% of initial projection might decrease over time, so surgeons consider this when planning. Patients aiming for a youthful, full upper breast look often prefer high projection implants, while those wanting a more understated result might choose moderate or low projection options. Ultimately, the surgeon carefully evaluates your chest width, tissue, and personal goals to select the right projection. This helps avoid an unnatural appearance or implant visibility and ensures you're happy with your results. In the end, implant projection is a key factor in how your breasts will look and feel after augmentation. It determines how far forward your breasts will extend, affecting fullness, cleavage, and overall shape. Choosing the right projection means balancing your aesthetic desires with your body's natural proportions and long-term considerations. Always consult with a qualified plastic surgeon to find the best fit for your unique anatomy and goals.